I welcome you all to the post-lunch session and today's final plenary session on aerosol therapy in children by Dr. Somu Sivabalan. I request Dr. Guru Prasad to kindly chair the session. Dr. Somu Sivabalan on the line.
Good afternoon. Very much pleasure to introduce Dr. Somu Sivabalan sir. He is a consultant pediatrician and pulmonologist in Rainbow Children's Hospital, Sundaram Medical College in Chennai. He completed his MBBS from our own college in 1994, and he has completed his MD Pediatrics in Kasturba Medical College, Manipal, Karnataka. And he has a DL in pediatrics, completed in 2001. And he has advanced training in pediatric pulmonology at Women's and Children's Hospital, Adelaide, Australia, and is a visiting fellow in the Department of Pediatric Pulmonology at Royal Brompton Hospital, London. And he has a certificate in pediatric sleep course. He has completed it in Singapore in 2022-23. He has established cystic fibrosis clinic in Kanchi Kamakoti Children's Trust Hospital, a tertiary teaching hospital at Chennai in August 2014. He has a number of awards, the recent one being the Honorary Professorship of IMO CGP in recognition of long-term services in medical education 2023. And he has been awarded with the Academic Excellence in Fellowship of Asian Pacific Society of Respirology from Japan 2022, and the Fellowship of Royal College of Physicians, Edinburgh in 2018, and FCCP in 2021. He has a number of publications. He has 67 publications, scientific articles in English journals, and 35 chapters in textbooks. And he is editor-in-chief of Scott's Pediatric Specialty 2023, and is author of a Handbook of United Airway Diseases. He has held a number of posts, with the recent one being the executive board member of IAP, Tamil Nadu State Chapter 2014, 23 and 24. And he has been a faculty in a variety of programs. And he is a good orator, where recently orated on common respiratory referrals, how to respond to challenges by IAP Kanyakumari branch, Nagarkol, Tamil Nadu. He is a good marathon runner. He has a good record in participating in marathon. So with this brief introduction, I will hand over to sir. Thank you, sir.
Thank you, Dr. Guru Prasad, for those kind words. I know it's a post-prandial session. This is going to be a very light-hearted session, okay? Meaning it's not much that you don't know. Even the backbenchers can feel free to come forward. And the topic is aerosol in children. You all will bless children, because all of them will say, children I don't like because they are crying. It's not always crying children, they are also cute little ones. They can also play with you, and they can also make you happy. Field to use, which field to choose, I might strongly advocate even pediatrics for you, right? That by itself is a specialty, though there are subspecialties developing now, but as of now, that itself becomes a specialty. And over a period of time, you become a family physician, meaning you start seeing kids from newborn period, and over 20-30 years, or 30 years, they also get married and their children start coming to you, and you start becoming a family pediatrician. So, few of my clients have started having children, and it was surprising to see both sides, bride and bridegroom, both being my clients, though they were not known to each other before. So, That's one good thing about pediatrics. And with regards to aerosol, you can be assured that aerosol can be given even when you are asleep. So even if you are going to sleep, I am going to keep delivering my talk on aerosol, right? Deepak? That's it. And the one big qualification I have is being an alumnus of this college, and this is my alma mater. And I was, our batch was the first to be posted to the hospital, which is here near you, and in parts, meaning some postings were in SNR, somewhere here, and that was it. And whenever we talk about something, we need to know the history also behind. My history dates back to 89 here. Initially, that was the fourth batch of this college, and that time ragging, though they say, was not there. It was very much there, though not bad. I didn't get my MBBS seat in my state, that is Tamil Nadu. So this is becoming my second state or my home state, meaning after which I get from Manipur. So it's very close to my heart. Kannada is very close to my heart. I can speak good bit of Kannada too, even now. I feel proud to talk whenever I see a patient who is a Kannadiga. So when I started here, that was 225.25 was the cutoff. I got 225, and so I didn't get there, so I was joined here. And that time, in first internals, failed in all three: anatomy, physiology, and biochemistry. Meaning that was the root shop. First time I failed, that in all subjects. And Putti, he was the principal before, and just while in time, so that the slides get ready. Putti was the principal before, was the assistant surgeon. He was a very soft-spoken man. And he was calling one by one and talking to you. And he said, he has a sticky accent. He said, you're like a cat on the wall. I didn't understand. He asked me, do you understand? I said, no. If you fall this side, you fail. He said, yes, sir. If you fall this side, then I said, I passed. No, you fail miserably. That's what he said. Meaning that was the record that time. So then I decided I did pass, and I did pass with distinction. And one of the few subjects where I got distinction was in biochemistry too. And even last time when I met him, I told him this. Of course, he would have forgotten, but I will never forget that. That was one of the life-changing moments in hospital. And the other thing is, everybody keeps saying, you have to upgrade, you have to think, you have to move forward. Nothing. Keep your eyes and ears open. Opportunities are everywhere, and things will keep falling into your ears. If you shut your ears and eyes, nothing will enter. So a lot of new opportunities will be there, and life keeps teaching you. Say for example, my first presentation was in the present community medicine. I was told it's the present community medicine hall. It was a big auditorium. Previously it was what would I say? It was exam hall, I believe. That time there was the first auditorium. Not presentation hall, and ours was the first CME being conducted there. I still remember it was on abortion. That time we had the OST. People do not know what OST is, what it projector. And I was presenting on the types of abortion. Sarkar was a HOD then. So the first candidate went, I was the second candidate to present. When I saw the crowd, I was really shocked. I said towards the last moment, I'm not going to present. Narayan Sami was a professor here, was an assistant there. Whenever we say no, we expect somebody to say, control us and say, go, you can do it. But he said, idiot, get lost. I was shocked. He said, idiot, get lost. Then I said, no, I will do it. Then he said, listen, today you have only prepared the maximum. And so you know better than anybody else in front of you. Treat everybody like an idiot, go present. That was one of the beautiful lessons. So that's what I follow. But don't think I'm treating all of you like idiots. The moment I was entering the hall, he held me back and said, idiots are the most difficult people to convince. Don't fool around. So that holds good even today. So don't take people for granted. Any presentation, whatever it be prepared, go in front, treat them with utmost respect, do what you're supposed to do. And the aerosol therapy, many aerosols are there. Just to give a preamble, most of the time, you will hear people saying, oh, ishtu chinna maguke, idu kodbeka. That's what they say. That is, nature is so cruel. He is having inhalers right now. I don't know how his future is going to be. They pity you. It was like a scenario when in some standard I started wearing glass. Here many are wearing, in the whole of my school only 2 people are wearing. Whenever I walk through the road, people will say soda butti. You understand what soda butti is? That's what they call anybody with the spectacles those days. It used to be so embarrassing because that time people are not accepting spectacles that openly. Same with spacer even today, right? Spacer is one thing, irrespective of whatever subject you choose, whatever specialty you choose, 2 things will be crisscrossing you. One is as a doctor, the other one is or your aerosol device. And adults, COPD asthma, children predominantly asthma and other indications of course. So these are the things you need to understand. So now the understanding and acceptance is the biggest problem. So we will cover all these things regarding what aerosol are. I want you people to communicate so that it doesn't become monotonous. So aerosol is nothing but whichever is being spread through a liquid form and that enters as you inhale. It's an inhalation device, so when you breathe through, the air goes in, along with that the medicine also goes in and falls into the surface of your respiratory mucosa. So now I told my history in a bit. So whenever you go through the history, you will know the importance of it and how it has evolved. So the respect for that also increases. But with regards to inhalation, this was there early since civilization. Even in Charaka and Shushruta time it was there. And Hippocrates time, they were using vapors through tube for angina. And during World War II, they were using Datura camps rooms, chambers for treating bees. This is one of the early depictions which has been documented with regards to inhalation therapy. Then in 1778, the first inhalation was formally being documented, and on the right side, it's not working well. The right end is your first inhalation device, and the first portable atomizer. This is the first portable atomizer. You can see the volume of those devices, and the first nebulization is this, and your first inhaler device is this. So from there we have moved to the smaller compact devices which are available today, and the aerosol drugs are multiple indications. Commonly we think it is for asthma, for croup we use in pediatrics, and cystic fibrosis, antibiotic and mucolytics, and it is being used as an anesthetic agent, and on the other indications also it's been tried. So in clinical practice, not only in pediatrics, even in adults, for the humans per se, asthma is the main and cornerstone of, the inhalation is the main and cornerstone of asthma therapy, and it has revolutionized asthma management. So now the question is, what is asthma? Anybody feel free. What is asthma? Can kids have asthma? Do kids wheeze? The moment we say heart attack, we always think it's only a old man or an old lady. Now we know anybody can have heart attack. Asthma, the moment we say, people think it is breathlessness, people having oxygen and immediately going to die. It is not so. It is an inflammatory disorder of your air tubes with causing recurrent airflow obstruction, and which is reversible. So if it is not reversible, that's different. If it is reversible, inflammatory condition of your air tubes and it is recurrent, it is asthma for you. Signs and symptoms vary, let's not bother much about that. And here, with regards to whether kids can have, because it's an airway disease, an inflammatory disease, the moment you have airway, you can have inflammation. Kids also have airway. All living human beings have airway. So naturally, they can also wheeze. One common thing is in children, infection-triggered wheeze. The moment we say asthma, magu yavadiki allergy and meaning it is not that it is always allergic. There can be multiple triggers, and one of the triggers is your infection for you. So asthma is a clinical diagnosis. So younger the children always think in terms of alternate diagnosis. Any recurrent wheezing with no alternate diagnosis, they are likely to be asthma. So that is one thing. So overall, it is not a straightforward thing. This means this means asthma. It's not like that. But you have to apply a bit of clinical sense to it and see how it goes. The moment we say asthma, the other question immediately comes is, nobody in our family has. Is it a hereditary property? No. and immediately they say, I have. Will my kid also have? Can my younger kid play with my asthmatic in-laws? So they think it is contagious, whereas it is not. And what is your take on family history of asthma? Do you need to have family history? Yes, basically it's something like that. It is genetic predisposition, that is your family history, environmental exposure, it's your triggers and your viral infections. So any, not even 2/3 majority like in the parliament, even if any one of the things is frequently and recurrently getting operated, they can trigger and cause an asthma in you. That is the current understanding. So if there is going to be a history of atopy, it is called an atopic lease, that is your family history or your personal history of atopy. If not, still you can lease. So younger user, continuing to be a user as you go by, then you can be safely labeled as asthma if you have no other probable diagnosis attached to it. So presence of family history of atopy is a risk factor. So absence of family history of atopy is not a protective factor, meaning nobody in the family doesn't guarantee you that your kid will not have. So that we have to have in mind. What is epigenetics? Have you heard of this term epigenetics? Genetics getting modified by your environment and expressing differently. The genes remain the same, but the expression of the genes vary. That is epigenetics for you. In simple terms, it's like that. The cat remains like a cat, but it expresses itself differently. The moment we say these, they all equated to primary complex. What is primary complex? It's your TB of your children. Children having TB is primary complex. And then all other terms like allergic bronchitis and eosinophilia are being used. And usually they say, X-ray ತೆಗೆದ್ರೆ doctor ಎಲ್ಲ clear ಅಂತ ಹೇಳಿದ್ದಾರೆ ಮತ್ತೆ asthma ಬರುತ್ತೆ. Meaning, if the X-ray is clear, it doesn't mean that you are not having asthma. In asthma, you expect the X-ray to be normal, and if your X-ray is abnormal, it can be in other conditions and also a complication of asthma. Also, people ask for allergy test. You cannot find out all allergies, and by an allergy test alone, you cannot solely blame that to be the reason, because it also requires clinical correlation. So the investigations are usually reserved only to rule out mimics, comorbid condition, and in difficult situations. So as I said earlier, TB, MATU being positive tells you TB infection. It doesn't even tell you that's a TB disease or not. And most of the time, heterosan is being used based on the eosinophil getting elevated. What is the role of heterosan in eosinophilia? Anybody? In filariasis, there can be elevated eosinophil. So when you treat filariasis with heterosan, the eosinophil count also will come down. So heterosan or your diethyl carbamazepine is not an anti-eosinophilic medicine. So that we have to have it in mind. And as I said, X-rays most of the time can be normal when there is air trapping. There can be hyperinflation. Non-specific periparahilar infiltrates can be seen. Very rarely when there are complications, there can be atelectasis or pneumonia or air leak too. And commonly we see paracardiac and pericardiac infiltrates. That is some fluffy shadows around the heart or here and there. And these are bound to happen in children. Why? Because there is something called pore of Kohn, pore of Lambert, and the channels of Martins. Those are the intra-alveolar, alveolar bronchial, and interbronchial connections. They develop only around 3 to 5 years of age. So they are for collateral circulation. So when one gets blocked, the other thing goes by. It are like small streets in between connecting your multiple highways. So when these things are not there, naturally, when there is going to be infection, there is going to be a stagnation of secretion, there is going to be microatelectasis and collapse, and these things can be manifested like pneumonia in X-ray. So these things you have to have it in mind. The moment we say these, people also ask what food to avoid. Can he sleep in a AC? He started having it only after going to school. That's a common complaint we can encounter. She started only after coming to the city. That's what they say. What are the answers for this? There is no general avoid rule. There are two things. Triggers can be irritants or allergens. Allergens are things that irritates you through your genetic predisposing mechanism, that is immunological mediated. Whereas irritants, they don't have an immunological mediation. Just like that, they are irritants. Like for smoke, anybody will get irritated. The degree of irritability varies. So generally to avoid all your irritants like a smoke and any strong odor producing you can avoid. But with regards to allergen, they have to be specific. I am allergic to brinjal, I cannot say you not have brinjal. Only if it is a specific association of clinical relevance, it can be told. And kids are prone for recurrent respiratory infection depending on the season, environment and contact. And most of the upper respiratory infection can last as long as 2 to 3 weeks also. And normal healthy children, even by studies, in a year 60 to 112 days they can have respiratory symptoms. Meaning around 3 months in a year they can still have respiratory symptoms. So these are the things. The social beliefs, all what they have is always in for surprise. How they can think like that, we have to even wonder how they can correlate things. We have to wonder. So these things are common. Now we go to the topic. Why aerosol therapy? Because when there is an eye problem, even if you say allergy can give a oral antihistaminic, they said, doctor, I think you forgot. What about the eye drops? When there is a ear problem for a AOM, AOM per se doesn't require ear drops, but people will ask for a ear drops. When there is a skin infection, they want an ointment to be applied. Whereas with regards to asthma, when you give inhalation, which is the equivalent of these things, targeted therapy, they will always say give it oral. So that is something. Most of the thing it is thought to be a strong drug, huge dose of drug, and it is a lifetime drug, and it is used as a last resort. Whereas in reality, it is a directly acting small dose, rapid action, and so because of the smallest dose, minimal side effects. So this you have to remember. The moment we say aerosol, people will say, how can a small kid have aerosol and how can they tolerate? And what are the contraindications? We have spoken about indication. When there is indication, there has to be a contraindication. What are the contraindications for aerosol therapy? Anything? Any child breathing with an indication can be given. Any child with an indication who is not breathing cannot be given aerosol therapy because inhalation is needed. So any breathing child, when an aerosol is needed, you have to find a device and equipment to deliver that medicine. So that is the prerequisite. Now you know FDA, that is the single dose inhaler with spacer. It can be used in children across age group. Very small children, it is used with the face mask. Why face mask? Meaning when children cannot coordinate through the mouth alone by holding the spacer, then we give a space mask. Of course, some amount of dead space and loss of drug will be there, but still it works. And with regards to the spacer, it's nothing but a holding chamber. It reduces the local side effect and improves the drug delivery. So don't worry about these things. And the other thing is dry powder inhaler. Of course, the prominent nebulizer everybody will be aware of. So the people will say, my child is crying. So can a crying child be given? Even the mothers will say, after stopping to cry, we'll give. Most of the time when the child is hypoxic, when not well, because of irritability and also anxiety, they will be crying. And if you are waiting for the child to stop crying, one, it can go for respiratory failure and asthma too. So cry is not a contraindication. And Westerners always write, give it in an unthreatened manner. And these are the ways it will be given. Like your blow-by technique or your table fan technique, meaning the child will be crying, the mother also will be moving this along, as if it's like a table fan. So it doesn't get connected through your Wi-Fi, meaning if you don't have a proper seal, they cannot breathe what is there in that holding chamber. So you have to be gentle, but deliver things effectively, because proper seal around the mouth and the nose is required for them to breathe through that holding chamber. So tachycardia again is not a contraindication unless there is going to be out of proportion tachycardia. One thing we should not miss is a tachypneic child with a cardiac failure, because this can worsen further, can potentiate a risk for arrhythmia. So that we have to have in mind. And why powerful, addictive and expensive drug, and why this last resort medicine for my child? That is the next question they will usually ask. And two group of drugs, that's a reliever and your controller relievers, or your salbutamol and your levosalbutamol. Controllers are your steroids and your long-acting beta agonists. And as I said earlier, MDA and spacer, the airway deposition is 10 to 20%, whereas with your microdose inhaler taken directly without your spacer, it's far too minimal. Whereas see the oropharyngeal deposition, it is much higher when taken directly without a spacer. When you take with a spacer, the oropharyngeal deposition is lower. So the local side effect because of oropharyngeal deposition can also be brought down by a spacer. And usually people will say, is it a strong medication? It is not. Is anybody of you on inhalers? Anybody using inhalers for your own indications? Or prescribed inhalers? Okay. What is the dosage in it? It is in micrograms. We all are medical students, not that weak in mathematics, so 1 milligram is 1000 micrograms. So in micrograms it is far too minimal, whereas all your syrups are in milligrams. And the inhaler, is it addictive? One of the common problems with inhalation therapy is when you say them the complaints is a problem. They don't use it for a longer time as we advise. If it is going to be addictive, in fact they should be overusing it or using for a longer time. So it doesn't happen. So it is definitely not addictive. With regards to expensiveness, I'll come to it later. Is it safe to use in children? Definitely yes, because far too minimal dose and any breathing child can be given. With regards to the expensive one, it looks a bit expensive, meaning it will be in thousands when you start with, whereas the same in extrapolated to nebulization, the number of man-hours lost and travel, this, that and other full expenses is far too high. It's like rented house plus a own house. So inhalation per se, it's not a costly, out of proportionate cost, and it is reasonable in its cost with regards to the effect. And in reality, oral is in milligram, inhaled is in microgram. It is not addictive, as I said earlier, and it is the mainstay for long-term management. And the moment we say inhaled steroids, people will always say, no, never steroid, doctor. And after all these Google mania and Google phobia, people say never to steroids. You give me whatever drug, but not steroids. Steroid is also a drug when used for a proper indication. We keep secreting steroids daily, so it is not something, it's not that anabolic steroids which is being abused and been in the headlines for wrong reasons. So with regards to the steroid dose, know the maximum dose what you can scale up to. Beyond that, don't keep increasing. Nowadays, what happens is anything and everything once started, they keep increasing. 1 puff 2 times, then make it 2 times, 2 puff 2 times, then 3 puff 2 times. It doesn't work that way. For some point in time, the dose response curve happens, after which the effect plateaus out. The more you increase the dose of steroid, then your side effect starts coming in. So the more the maximum dose, don't scale beyond your maximum dose for that particular indication. So they say, I am being treated of wheeze and now I am asymptomatic. We always see the asthmatics taking inhalers for a longer period of time. They will think that I am fine, then why should I take asthma medication? That is because as in kidney they say 1 kidney is enough, liver they say 50% of the liver is enough, and Guru sir will agree, lung also it has lot of reserves. Even by cutoff, anything above 80% we call it normal. Here, even a 50% reduction in lumen, roughly, will do good for your day-to-day activity. So people will not even know they are symptomatic. So the inflammation, the lumen is already narrowed because of the inflammation. Any slightest trigger, bronchoconstriction worsens it further. So to bring down the already narrowed lumen because of your inflammation, we need to give anti-inflammatory for a longer period of time. Do kids have beta-2 receptors? All of you. Even those who are sleeping can wake up. Do kids have beta-2 receptors or not? Always they will say, kids don't give nebulization, it will not work because they don't have the beta-2 receptors. It's never true. Beta-2 receptors are there right from 15 weeks of gestation onwards. And in bronchiolitis, which is common form of manifestation of wheeze in younger children, the effect doesn't happen at the level of the larger airways, causing bronchoconstriction. It is a narrowing of your airway because of inflammatory muck, which is far too lower down. That's why your beta-2 receptors action also doesn't seem to be like an action because it's not real bronchoconstriction. That we have to know. It's not for the want of beta 2 receptor, the child is not responding. It's just that the pathology is different and the site of inflammation or your narrowing is different. And now oxygen-driven nebulization. Why nebulization should be given with oxygen? In your ER also, I am sure it will be given with oxygen. Why? There is a phenomenon called paradoxical hypoxia, meaning it doesn't cause bronchodilation alone, it also causes vasodilation. So VQ mismatch can get a bit more, and already existing hypoxia can worsen, and child who is already hypoxic, when there is worsening, there can be potential for arrhythmia and sudden deaths can happen. That's why they have advised oxygen-driven nebulization. And now, mind you, you can even use for moderate and mild V's, even without hypoxia, to the extent even severe ones not with hypoxia. MDA with spacer is as effective as your nebulization. So MDA with spacer, even 3 to 4 puff is equivalent to one nebulization. One nebulization takes anywhere between 10 to 15 minutes, whereas your inhalation of 3 to 4 puff hardly takes 1 to 2 minutes. So people will always say, instead of nebulization, instead of spacer, give nebulization, because it's easy to take. It's not easy to take. They think it is easy to take. Lot of wastages and the larger dose is also given. But when adapting to this, it is far more safe and economical and effective too. My neighbor told me kids will outgrow asthma with age. So why treat? Shall we wait? People always say, no, as they grow by, they get better. So is that true? No. When do you enter college? At what age you enter college? 18? Okay. So supposing 4-year-old child has failed in 5th standard, 10-year-old child has failed in 5th standard. Can I say it is okay? Take them off school, by 18 years we will join them in college. No. You have to do what you are supposed to do then. So if a child is suffering today, treat the child today so that the probability of they getting better over time is much high on the card. It's not that one fine day they get better. So if you are suffering today, treat them today. And is asthma a curable disease? Though it's not said openly, once an asthmatic for life you are an asthmatic, only thing is whether you are symptomatic or not. If you are not symptomatic, it means you are in remission. Prolonged period of remission is being equated to cure. Like nephrotic syndrome, rheumatological manifestation, I am not equating to that severe ones. It also is an inflammation of your airway, it's an inflammatory disease. So steroids are an anti-inflammatory. So if you are not symptomatic, means you are in remission. So longer the remission is equated to cure. So what is the goal of treatment? Goal of treatment is quality of life. Right? If your quality of life is good, meaning the child should eat well, play well, sleep well, and grow in par with its potential of child of similar age group or the peers. So these are the things we aim for, without hospitalization, without emergency room visit, without too many medication, and even if on medicine, the child should not be suffering from a side effect of the medicine you give. And do inhalers prevent respiratory infection? Now for anything and everything, any cold cough, any cough is equated as wheeze and put on inhalers. And people think when you put on inhalers or when you take that flu shot, you will not get a respiratory infection. Neither of these two are true, because inhalers are only for predominantly asthma-related things, and respiratory infection is a different ballgame. And too many tall claims, if you give inhalers, you will not get it. That's what they think. And now even the Westerners have started recognizing it, and it has gone the other end. People who are not on the indication list for these medicines are using it like fashion accessories, and they form a real sore group. They will say it doesn't work because it's not being given for the right indication. I'm seeing that people who are supposed to have for the right indication are also very hesitant to have them. And with regards to literature, how many of you read journals? Too young, but still. Published articles are almost confusing and uncertain. Why? Because our mother tongue is not English. How many of your mother tongue is English? I am sure most of you it is not. What happens is, initially we start to read. Why? It impresses me whether an atom has been identified or a gene has been identified for a condition which I am not going to see in clinical practice. So now for passing you need to know a whole lot of things. After that, as a specialist, you will be narrowing down. Even as a specialist, you have to know what is happening around and be aware of what are the progresses in that. Supposing you are an ophthalmologist, you may not say, I am not going to see COVID. Because people will ask you what is COVID and things like that. You do not treat, but at least have to give them valuable suggestions. And most of the literature, they will conclude saying, not routinely recommended, not of much benefit, not so uncommon. So you will not know whether it is recommended or not, whether it is of benefit or not, whether it is common or not. So these will be confusing. But when you read the literature, read them by the essence of it and not the conclusions alone. So see how it goes by. Overall, when people think that aerosol is harmful in children, it is like thinking swine flu, they say pig flu. So after getting swine flu, none of the children turn to be like this. So inhalers are not the end of the world. And the key messages are, basics remain the same with regards to asthma, but the concept, it applies for every diseases. The concepts keep evolving. We have to change our practice to adapt to the changing concepts. And with regards to asthma, use inhalers and inhale corticosteroids judiciously. And parent education is one of the paramount thing important in convincing people. And drugs control with regards to asthma, but does not cure. That is because it's an inflammatory disease. And last but not the least, inhaler does not prevent all respiratory symptoms and infection. Thank you.
Very nice and smooth describing clinical features, diagnosis and management, and also stigma associated with using inhalers. One of the most common questions asked, the patient asked, patient relatives asked, patient parents asked, the consultant. Very nicely described, sir. Thank you very much. Any questions will be taken.
Thank you so much, Dr. Soma Sirvan sir, for an amazing presentation. May we ask Dr. Prabhakar, Principal Sir, to kindly give the token of appreciation to Dr. Soma Sirvan sir.
Prabhakar sir was my teacher and is my teacher.
May we ask Prabhakar sir to give the token of appreciation for the chair. We will shortly be starting with the valedictory function. I request all to please be seated.
afternoon, everyone. Respected dignitaries, esteemed guests, faculty members, dear students, and all participants of Demedcon 2024. It gives me immense pleasure to welcome you all to the valedictory function of Demedcon 2024, a truly special event that has been a remarkable journey of knowledge, sharing, inspiration, and discovery. This event is sponsored by Sri Deva's Educational Trust Pharma, Jardale Industries, Medical Education and Research Trust Karnataka, Inox Pharma, Microlabs Limited, Neon Laboratories, Cipla, Maro, Kotak Mahindra Bank, APR Med Solutions Private Limited. As we gather here today to conclude this space-themed edition of our National Undergraduate Medical Conference, I can confidently say that the experience has been nothing short of extraordinary. I invite our dignitaries onto the stage with us. Dr. D.V. Prasad Sir, Chief Administrative Officer and our Chief History. Dr. Prabhakar K, Principal Dean Faculty of Medicine, SDUAHER. Dr. Vinita Shankar MS, Vice Principal, SDMC. And Dr. Vishwas, our Organizing Chairperson of Demedcon.
Ona.
May I request Dr. Vinita Shankar, Vice Principal of SDMC, to deliver the welcome address.
Good afternoon, everyone. As we draw the curtains and come to the end of this 3-day scientific feast that we hosted at Sri Devaraja's Academy of Higher Education and Research, Demedcon 2024 was a very gratifying, satisfying and academically enriching experience. To this event of valedictory function, I welcome our Honorable CAO Sir, Dr. D.V. Prasad. Whose support has helped us navigate through this 3-day journey. I also extend my heartfelt welcome to Dr. Mulinarayan Sir, our Registrar, who has said yes and granted everything that we asked for and made this a smooth conducted event. I extend my heartfelt welcome to Dr. Prabhakar Sir, our Principal, whose support and constant encouragement has taken us to this heights. I also welcome Dr. Vishwas, organizing chairperson, along with Dr. Ashwini, who are instrumental in this resounding success of this particular program. I welcome Vishwas and Ashwini too. Most importantly, our student organizing secretaries, Deepak, Nachiket and Likita, have left no stone unturned along with the committee members, and their tireless effort, both. I welcome you three for this valedictory function. You can breathe easy from now on. Nachiket? So I also welcome the faculty coordinators who have really stood by us and imagine leading a pack of students. So every event, every session was possible because the faculty coordinators constantly guided the student volunteers, and the results were there to see. I'm sure the delegates will agree with me that every event was glitch-free. Thank you so much, and I welcome you all for this valedictory function. I welcome the student delegates, without whose presence, like you added charisma to our institute, and delegates from outside and our internal delegates, and you are the reason for which this event was conducted, and we're so proud today. And I welcome the ancillary staff who supported us for this event. I welcome one and all.
Thank you, ma'am. I welcome Dr. Vinita Shankar, Vice Principal and the guiding force behind Demedcon 2024. Welcome, ma'am. Over the past 3 days, we have had the privilege of witnessing the exchange of cutting-edge ideas, innovative research, and thought-promoting discussions. This wouldn't have been possible without the relentless efforts of our organizing committee, volunteers, delegates from across the country, and all those who have worked tirelessly behind the scenes to make Demedcon 2024 a grand success. On behalf of the organizing committee, I would like to extend my heartfelt thanks to all our distinguished dignitaries, guest speakers, moderators, panelists, who generously shared their time, expertise, and experiences. Their contributions have truly elevated this conference, and we are deeply grateful to all who have contributed. Next, we move on to the presidential address. May I now request Dr. D. Velan Prasad sir to address the gathering.
Whereas Principal of the Downstream College, Dr. Prabhakar, Registrar of the Academy, Munarayana, Vice Principal of the College, Dr. Vinita, and Dr. Vishwas, Organizing Committee, Co-Chairman, and Chairman of this Demedcon, Organizing Chairman, Dr. Ashwini. All my teaching faculty members, participated students for a year. Very good afternoon to one and all. Thank you very much for giving the opportunity to the organizing committee and invited me to be with all of you for today's gratitude function of this Demedcon. I hope all the students will enjoy from these 3 days this Demedcon conference, and this conference I want to give a brief message in this conference. Basically, the theme of this conference is unveiling healthcare research to practice. It embodies not only our dedication to the medical field, but also our commitment to bridging the often gap chasm between the theoretical knowledge and practical application. Over the past few days, we have immersed yourselves in a plethora of ideas, discussions, and discoveries that reflect the dynamic nature of healthcare. We have engaged in enlightening sessions, explored innovative research, and fostered meaningful connections. Each presentation, panel discussion, and workshop has underscored a fundamental truth. Research is not only merely an academic pursuit, but a vital cornerstone that people's healthcare forward. Healthcare is a tapestry woven from the threads of diverse disciplines: science, technology, ethics, and compassion. Our team reminds us that the fruits of our research endeavors must not remain confined within the walls of academia, but must translate into real-world applications that enhance patient care, improve health outcomes, and ultimately save lives. The journey from research to practice is not always linear. It requires tenacity, creativity, and willingness to learn from failures. It is a path paved by those who dare to challenge the status quo those who seek to understand the intricacies of human health and illness, and those who aspire to implement innovative solutions that make a tangible difference. I would like to take this moment to acknowledge the efforts of the organizing committee, our mentors, and each of you who participated in this conference. Your dedication and hard work have made this event not a resourcing success. I request all the gathering here, give him a big round of applause. My organizing committee, chairman, co-chairman, and other participants involved in this conference to make it a grand success one. Give him a big round of applause. As we conclude this chapter of the Demedcon, let us carry forward the spirit of inquiry and passion that characterized our time together. May we remain curious, open-minded, and driven by a desire to improve the lives of those we serve. Let us foster a culture of collaboration and innovation, supporting one another as we navigate the complexities of healthcare. Your journey and contributions to healthcare inspire us all to strive for excellence and to remain steadfast in our mission. Together, let us unveil the future of healthcare, ensuring that our research translates into practices that uplift communities and transform lives. Thank you, and let us continue the forge ahead with purpose of determination. I once again thank all the committee members giving the opportunity to be with us this fine evening, this valedictory function. Thank you one and all.
Thank you so much, sir, for the encouraging and inspiring words. It means a lot for us. Sir has played an integral role in administrative and Demedcon related activities of our academy. We are very privileged to have you here, sir. I now request our registrar, Dr. Narayan sir, to address the gathering. A few words, sir, please.
Respected Chief Administrative Officer, Mr. Prasad sir, beloved Principal, Dr. Prabhakar sir, Dr. Nikita Shankar, Vice Principal, and very importantly the organizing of these Demedcon, Dr. Ashwini and Dr. Vishwas, and we are friends, students. So as we have come to the end of this Demedcon, so every year the Demedcon is going very strong, and we are attracting many delegates, student delegates from across the nation, and also from the international students also. We feel proud that this conference organized by the students in a befitting manner, and we could see the students very actively participating in all the sessions. We heard that many of our alumni have come here and delivered lectures on various subjects, and also they had a hands-on experience on these various topics. So it is a very good thing that the students are actually participating in this conference, and all these organizing chairpersons, and especially Dr. Nikita Shankar and
I thank the organizers for giving me the opportunity to address you all, and all the best. Thank you once again.
Thank you so much, sir, for the encouraging words. Sir has always supported us and has ensured smooth functioning of our conference. Thanks a lot, sir. May I now request our principal, Dr. Prabhakar, sir, to share his thoughts and experiences on the conference. Over to you, sir.
Respected Honorable Chief Financial Officer Dr. Demedcon sir, Commissioner Dr. Mudana, Dr. Uta, Shankar Vice Principal, Dr. Ashwini, Dr. Vishwas, and my dear students and my dear colleagues. At the outset, I would like to push the thought of Demedcon, which was there for ranking, we had started in 2013, and successfully we are adding till like 16, 17, but for some reasons also due to the COVID, it was disrupted for a few years. Then the beginning of this year, myself and Dr. Virita, so we wanted to this sort of organizing Demedcon came into our minds. And yes, there were a few challenges in the beginning, and I would like to acknowledge that when I expressed my desire to begin this, to organize this event, I met our CAO sir and asked him about then I took his opinion about the organization Demedcon. Then, as usual, any conference of this use we need finances. Usually, ours is a self-financed institution, so we don't get any funds from any external sources. So we have to generate funds from ourselves only. So then, when we thought about the budget, then I expressed some amount to the sir. Sir did not tell one word also. He said, let us go, we will take a meeting with management. So next day we met management, and I'm very proud to say that belong to this institution where we have such a generous management. Our chairman, our Mr. Nagaraj sir, when I asked him, I said that we are going to organize the conference, and I also initiated, because as soon as I said about the conference and its details, I also sufficiently budgeted. Usually the management will take it twice, or they will just try to postpone things, but I'm so proud to say that the management did not again take much time. I said, go ahead. Then I was just wondering myself, sir, without asking the details about anything, he is just, when I gave him the big budget, running few lakhs, sir said, did not say anything, please go ahead. Then I got real courage to organize this event. Then I went back to my office and I spoke with Dr. Mitra. So as usual, I can definitely say that without her support, without Dr. Mitra's support, this event would not have become realized. I would like to, because see, unless the people, just like the principal, can only give the thoughts and give the ideas, but actually I need the soldiers, and she behaved like a chief commandant, and she again, she recognized the real talent of the campus, especially Dr. Vishwas, Dr. Ashwini, and all our faculties all came forward. And whenever we asked any faculty to help us, again they did message works and they just said, yes, we are going to cooperate. And this just of right to thank each faculty member here who really cooperated and who joined our hands to organize this event. Next comes so-called our students' meeting. So I would like to thank again the three important pillars among the students, especially Kate, Deepak and Nikita, and the entire team. I can say each one of them. I never knew that these boys and girls are so educated and so enthusiastic and so risky. Within a matter when we start off coming, always this event came to my mind, and when I
expressed my ideas to Dr. Rita and my other colleagues, the Vishwas and Ashwin. Within a week, these boys as well brought a list of the events to their mind, and also some faculties they also recognized, and which the faculties which are not from our state and outside state also, who are so expressive in the field. And I was just wondering, these fellows look so dumb in the classes, and how come they have such a great ideas? And they is so much excited and so happy to see that these boys and girls, they did an extremely good job. And now, it's like they say, definitely like one thing came to my mind. You people are no less than any student from BMC or any less than any AIM students because you are such a color talent. I'm so proud of you. Because the way people formulated the brochure, the ideas that attracted the mind, and even I think the initial video you made with me and all the things I was going through the Instagram and the Facebook and all my friends, they all know like different parts of India, and my students also, they personally spoke to me and they said, how come sir, this is what your college is something different, such a fantastic, small video clips and all I see everywhere in the YouTube also, so which I didn't see some such initiative. Then after they mentioned that I started seeing that, and extraordinarily they felt the pre-event section, pre-event videos they released in social media, and I think they became very, very popular. And I'm sure that these video clips and also what went on for next 2 days would definitely take our institution to a different level. I always feel, before I became principal, I should think that as an academy we are doing so many things, especially for students, for the staff, and for the patients concerned. Somehow that it's not getting properly, what should I say, known to the public or known to the different academicians. Maybe the problem lies is a place where they are situated like Kolar, and which is not a well-known city, which does not have much infrastructure facilities. Anybody think about Kolar, maybe recently something like KJF might have made our city popular. Otherwise, Kolar is not many people would be knowing what is Kolar about. But thanks to this institution like State University College and this University Academy, at least the name of this Kolar, now the Kolar without any comma, we just said yes, we are coming, please go ahead. So they didn't even tell us whether the time is convenient or not, or the arrangements were made or not, nothing they asked. So they had so much confidence on our institution and our faculty. They said that the other special colleges is you people doing everything very properly, in the correct manner, in the very perfect manner, in very this thing. So that shows that the confidence which the faculty accepted our invitation shows that. So our college has got extraordinarily it has generated a passion among the social faculty across this country, across the state. So all the faculty came, and I really appreciate all the faculty who came to us and definitely gave their wisdom to our students. And from there I'm watching from the day we had some technical issues with audio aids and other things. I'm very sorry for that. So maybe after some time it got all corrected. And we have very enthusiastic, all of you should accept my opinion. We had such a passionate teachers. For example, I can give you Dr. Pasalamur, who did some workshop yesterday, so 3 hours or 3.5 hours regarding the new economics and diabetes. In fact, I was saying that great person who is 70 years old and is internationally famous faculty did not cite 1 second also. He was total clear. He was just so much keen in teaching the students about the new technologies and answers writing, the way he gave answers writing to the students. It was amazing and this is all of the answers that you will never forget those teachers. Definitely, I'm also feeling envy about you because I never had such type of exposure during my UG days. So I tell you, believe it or not, I attended the first national conference when I entered the final year of my institution. Because of those days, so especially during your MBA also, during the PG days also, our teachers never allowed us to attend these so-called CLEs or these conferences. The reason is because the workload is so much there. So if these fellows go for conferences or no one will be able to take care of the patients. As you know, in the government college, 8 to 8 will be our interns and the PVCs. So the conversations we had in our days, I think they're all lucky that each faculty who are experts in their field, they have given such a great vision. It is up to you to do. I think I need the receptor now. They have already given you the so-called transmitters. Now up to the receptor, that is your brains and what should I say, attitude. You should decide how much you take from these great teachers, and you try to help in carry out your career in the future. So at each, I think, I without any doubt, I can definitely say that the store nowadays, whatever you had, the different teaching programs, the different teaching events at a different level, during sections or workshops, or the portions of the wherever the events are held. I think every event was very useful for this all the stakeholders here. And second thing is, now after the beginning of this event, when myself and Dr. Kripta discusses about conducting this Demedcon, I was also getting worried about whether it is going to clash with our ambitions, because as I said to this offices will have at least one or other responsibilities apart from this teaching ambitions, because other people happening at the university. So I was thinking whether this Demedcon clash with our ambitions, where this is our space would be a great clash with everything I was thinking. But in God's grace, the dates did not actually it not cause any issues for us, because admissions of UG most of October 15. So we get students after maybe 2 weeks to get the students to campus. So that offered so-called accommodation issues. And at this station, I would like to thank all the principals, like law conference, different colleges, from Nandi Medical College, Akash, previous from Academy, University, Medical, Tirupati, all across the state and across the different states of the country. I please convey my thanks to all the principals concerned for giving permission and for allowing me to participate in this event. And you people are making this success. And I made a strong resolution of this total basis in all the talks. And especially some people are very passionate teachers. Now I could identify so many teachers who came here and they're ready to teach our students what should do today. One teacher was telling me, one speaker was telling me that I will conduct the so-called value-added courses, or I will conduct the electives for your college. I won't charge anything. I am a very passionate teacher. I want to teach the students. So I could identify some teachers of that nature during this conference time, so that they will be definitely useful for imparting their knowledge and their expertise to the students very often. I think we are going to make a list of those teachers, and I put those names in front of our academy. For the approval, we can call them as a guest faculty, or we can call them as something for adjunct faculty. I think the academy will take a decision for this. And I think I had left me with a lot of good experience. As I was telling, I am implementing my students. First thing I did, the what lessons I learned in this conference. One thing I got a courage that we can definitely organize an event with all these enthusiastic people around me. Number two, my students are more or less than the other students in this country. The way they work for this conference, the way they coordinated the speaker, the way they did everything for us, it will be reminding my memories forever. I think this event definitely will never go out of my memories in my life. So thank you for all of you for giving this wonderful feeling in my life. So to look back, whatever that I achieved, okay, reaching level patient in everybody's lifetime as a human being. But what I feel is through this event, through my help of my CEO sir, and my sir, and my chairman sir, and management, and with the help of all the teachers, I cannot forget this event because it will remain in my memories forever. Because I could, through the such excellent faculty, at least out of maybe 450 or 500 delegates here, at least 50 to 100 students who will get some inspiration from these talks, and they would change the direction they think about the medical science. At least I think one teacher today, he mentioned about I think today we had some great persons from Narrow, was speaking about why he feels so proud about being a doctor or being an MBBS. So that also whatever that even I had, even I was having thoughts several months about whether this profession is worth something that we're doing in this part of my life. today, I think all youngsters is what makes us company. That this profession, all of us should adore it, should practice it with passion, and should never look at okay, money things, because it's every day you're a hero here. Every day you are going to heal some person's agony or some diseases, something, whatever it is. And you can remain in their memories forever. I think no other profession can be equal to this medical profession. That just Rakesh Nayak today accepted in morality. I think those words are really great words. I think all youngsters would definitely get some so there's some solace, especially when you think that your colleagues in engineering field or other fields are very better than you in respect to financial matters. But I think the way he spoke about, great about our profession, would really make all of us realize the importance of profession. And also he said one thing that you this UG time and this so-called internship time, don't think about reading manuals or reading some matters, everything else. Please concentrate only on the hospital patients and hospital teaching and teachers. If we in the field and you can read those books, most important thing what I said right here, I would like to emphasize today to all the youngsters here, please dedicate your time to the patient care. So no, our wards are always open, your all hospital wards is open, so you can visit the patients every day. Don't think that only 9 to 12 or 9 to 1 you need to stay in the hospital. You can go after 4 o'clock also, go to the hospital and see the intensive cases. You can go across all the departments. Every time, every day, at least 1 or 2 intensive cases within every ward. Go to the patients and learn about them. Definitely without the serious in your respective institutions, like PEs or like teachers. At least in the institution for the 20% institutions be dedicated to teach you. Please make the help and see as many patients as possible. I think once you see many patients, once you get great medical care, definitely you are going to click in your future accommodation on the clinic or USM and whatever it is. So these 2 minutes, so I would like to thank once again all the stakeholders concerned, all of you who helped to make this conference such a great success. Thank you very much.
Thank you so much, sir, for thought-provoking words and for being an inspiration to all of us. Sir has played a major role in organizing Demedcon. We are privileged to have you, sir, and each one of our distinguished dignitaries on stage. A huge round of applause to our dignitaries. This event wouldn't have been possible without our distinguished dignitaries on stage. Thank you, dignitaries. Now I would like to invite our dedicated organizing secretaries and joint organizing secretaries with team manager who have worked tirelessly to make this conference a success to present the official report of Demedcon 2024. I request our organizing secretaries and joint organizing secretaries to come forward to present the report. Over to you all.
As the organizing secretary of Demedcon 2024, I am delighted to share the incredible success of day 1 of this prestigious event. With an overwhelming attendance of 462 delegates, both from international and international institutions, the first day set a high standard for the rest of the conference. The event commenced with a memorable inaugural ceremony, and we are deeply honored to have 2 exceptional personalities as our chief guests, Dr. Pratima Murthy, Director of NIMHANS, and Dr. Tessie Thomas, the renowned missile woman of India. Their words of wisdom inspire us all, highlighting the value of leadership, resilience, and the pursuit of innovation, not only in healthcare but all fields of life. The scientific sessions were at intellectual fields. Dr. R.K. Prasad's insightful Day 1 report provided an excellent overview, while Dr. Deepa Joswani's talk on research capacity building ignited a sense of purpose among the participants. Additionally, Dr. Sharad Srinivasan's session, Rebooting the Brain, was nothing short of fascinating, transporting our imagination beyond the boundaries of textbooks and into the future of medicine and healthcare. Our quiz and debate committee did a fantastic job of organizing competitions that engaged the delegates both academically and critically. The quiz sessions were challenging, while the debate saw heated yet thoughtful discussions. Participants delved into key topics such as purchasing power, lifestyle changes, health GDP, and doctor safety, showing not only in their knowledge but also their passion for the field. The day ended on a high note with a social night, which turned out to be a super hit session with a vibrant, glow-in-the-night party theme. The atmosphere was electrifying as the delegates enjoyed a night full of fun and entertainment. The highlight of the evening was a stand-up comedy performed by the famous Dr. Jagdish Chaturvedi, which had the audience in splits and created a relaxed, joyful vibe. The night brought everyone together, adding a layer of bonding and celebration to the academic revival of the day. Over to Deepak.
Thank you, Nikita. Good evening, everyone. As the organizing secretary, it is a privilege to present the highlights of Day 2 of Demedcon 2024. Yesterday was a perfect balance of learning, skill building, and entertainment. We began with a morning workshop with an hands-on session on basic surgical skills, GI endoscopy, and ECG medicine. We also dealt with key topics such as cardiac, cognition, and research methodology, along with the life-saving skills like triage and emergency and pediatric emergencies. Midday, we had a lecture. We were honored of hearing Dr. Mr. Radhakrishnan sir, whose lecture was insightful and inspiring on the deep thrombosis disease. After the workshop began by 2 p.m., we taught students with infertility and IVF, BLS, oxygen therapy, along with advanced topics like technology in diabetes management, analytical toxicology, radiology and simplified. Additional sessions with basic surgical skills were also included. Evening events happened at 5 p.m. at Spelling, block and tactic, and fun stage play and movie night. Day 2 was a great success, filled with valuable experiences and lively evenings. Let's carry the momentum into our final day, make the conclusion of Demedcon 24 such as this remarkable. Thank you. I over to Nachikeet for the Day 3 review.
Thank you, Deepak. So, today being the final day of Day 3 of our national conference, I would like to give some insights on the events which we witnessed today. We started early today with the finals of quiz, CPC finals and results. It was a great day with few plenary sessions by Dr. Rakesh Nayak, Dr. Somu Sivabalan, Dr. Jalili, Dr. Sethi Parikar. It was a great pleasure to hear them all, and the take-home message which we get from Dr. Rakesh Nayak is that we have to enjoy our engineering journey. From journey now is that the data is the thing, but the context is the thing, and we get to know about the aerosol therapy in the children from Dr. Somu sir. And finally, I would like to hand over to Samsung. Thank you.
Good afternoon to one of our present here. My name is Faris.
My name is Pooja.
We are joint organizing secretaries for Demedcon 24. I would like to start off with the respected guests, dignitaries on and off the dais, and my team members and colleagues of SDUAHER. It is an honor and a privilege to stand before you to share my thoughts on our conference, Demedcon 2024. First and foremost, I would like to thank our chairman, Dr. Yadav sir, whose visionary work would make all this possible. Our sincere thanks goes to respected President, SDUED, and Chancellor, Sri T.S. Nagarkar sir, Vice President, SDUED, Sri Rajendra sir, Secretary, SDUED, Sri Hanumantan Raja sir, Chief Administrative Officer, Dr. D.P.L. Prasad sir, Registrar, Dr. Muninayan sir, Principal, Dr. Prabhakar sir, and Vice Principal, Dr. Vinod Satana. I would like to thank all of you for coming to this, and it wouldn't have been possible with Dr. Ashwini Ram and Dr. Vishwas sir. It was really nice to see all of the delegates take active part in workshops such as basic surgical skills, ECG made easy, emergencies, and pediatric emergencies. I hope you guys had a lot of fun, and hope to see you guys next year as well.
I would like to thank all of you on behalf of my team, organizing team, and I hope to see you all next year also. Thank you all. Thank you, organizing secretaries and joint organizing secretaries of the team manager for summarizing the key events, sessions, workshops, and overall participation of the conference. We now move on to the most awaited session, which is the prize distribution of various events that were held in Vivek, Selvi and SK Group. I now request our dignitaries to come forward for the prize distribution to the winners. So, we'll move on to the quiz winners. This is the moment we have all been waiting for the winners of the quiz competition. So, this event was sponsored by Sri Nagaraja Rao Archacharya sir, and it goes with sir's name. The third place of the quiz goes to Dorado team. Akadita Das, Amita, Ashutosh Sahu, Bhavika K from Sri Devaraja Medical College. I request Dr. Geeta to join us for the prize distribution of quiz. She has been the quiz master for this event.
Madam, Geeta ma'am.
So they receive a prize money of rupees 10,000 sponsored by Sri Nagaraja Rao Archacharya sir.
Yes, madam, 1 second. Yes, 1 second. Yes. Sir, thank you.
The third place was received by Cosmo from Sri Devaraja Medical College. The second place goes to Dr. P.R. Ambedkar Medical College students, Dorado, Mr. Abhinay R, Aditya, Parikshit and Venkatesh. They receive a prize money of rupees 20,000.
Come to number 26. Yes, sir. Yes, yes. 1 second, 1 second. Thank you.
First place goes to Sri Atal Bihari Vajpayee Medical College students, Borealis, Prerna Anil, Nikita Manjuna, Shashank and Sagar S. They receive a prize money of rupees 30,000, sponsored by Sri Nagaraja Rao Archacharya sir. The total prize money of 60,000 rupees was sponsored by Sri Nagaraja Rao Archacharya sir. A huge round of applause to these winners. Thank you, Dr. Geeta. I request our dignitaries to present a moment of appreciation to Dr. Geeta. I request our dignitaries. Dr. Geeta was the quiz master for the event.
Yes, madam. Yes, madam.
So let's begin by recognizing the winners of the research oral presentation. The first prize goes to Piyush Pandey from Sri Siddhartha Institute of Medical Sciences. Congratulations, Mr. Piyush Pandey. Give him a huge round of applause for taking the first Congratulations.
Thank you.
So he receives a prize money of rupees 10,000 for the research oral presentation. The second prize goes to Dhanman BN from Siddhganga Medical College and Research Institute. He receives a cash prize of rupees 7,500. Congratulations, Mr. Dhanman.
Yes, sir. Yes, yes. Thank you.
The third prize is awarded to Shubha SN from KLE Jagadguru Gangadhara Mahaswami Medical College, Hubli. She receives a prize money of rupees 5,000 for the event.
Yes, madam. Okay.
She receives a prize money of rupees 5,000. Congratulations. We now move on to the poster presentation winners. First prize goes to Rachel Gupta from Demedcon Medical College. She receives a prize amount of rupees 7,000. She receives a prize money of rupees 7,500. Congratulations,
Yes,
Ms.
yes.
Rachel. She is also the class rep for her batch. So she represents you all. Congratulations. Second prize is awarded to Jennifer B. Stephens from Shivera Jaras Medical College. She receives a prize money of rupees 5,000 rupees. Jennifer B. Stephens from Shivera Jaras Medical College. Congratulations. Third prize is awarded to Nihan Pediatrician from Saptagiri Institute of Medical Science and Research. He receives a prize money of rupees 2,500 for the poster competition.
Yes, yes.
Congratulations to each one of you for your innovative and well-crafted posters and oral presentations. I now call upon Dr. Shilpa and Dr. Rashmi to come onto the stage. They organized the scientific, they were in charge for the scientific presentations. On behalf of the team, I thank both of them for conducting these events on scientific and oral presentations. I request the dignitaries to hand over the memento of appreciation to Dr. Shilpa and Dr. Rashmi. A huge round of applause to these two.
Yes, madam. Yes, yes. Madam, ange ban. 1 second. Okay.
Thank you, dignitaries. Thank you, Dr. Shilpa and Dr. Rashmi. Moving on to the next event, that is Escape Room. We move on to the exciting Escape Room competition winners. The first prize goes to Abhilash S. Nanda Manjuna, Sriharendra from Nandi Medical College and Research Institute, Chikbalapur. They receive a cash prize of rupees 5,000 for the event. Congratulations, Abhilash, Manjunath and Sriharendra. Give them a huge round of applause. So they win the first place for Escape Room competition.
1 second, sir. Thank you.
The second prize goes to Sreshta Gunila Kanya and Purva Gupta from Shivera Jaras Medical College. They win a prize amount of rupees 3,000 for the event. Congratulations, Sreshta, Tanya and Purva Gupta from Shivera Jaras Medical College.
Yes, madam.
Well done to these brilliant minds for cracking the code and escaping first. Congratulations, both the teams. Next, we move on to Art and Medicine winners. For the art and medicine competition, we have the first prize, Prerna MN from Sri Atal Bihar Vajpayee Medical College and Research Institute. And congratulations, Prerna. She receives a prize money of rupees 3,000. For the art and medicine competition, first prize goes to Prerna MN from Sri Atal Bihari Vajpayee Medical College and Research Institute, Bangalore. Congratulations, Prerna. The second prize goes to Sagar S from same college, that is Sri Atal Bihari Vajpayee Medical College and Research Institute, Bangalore. He receives a prize money of rupees 2,000. Congratulations, Mr. Sagar S.
Yes, sir.
Congratulations, Sagar. The third prize goes to Serna Sakshi from TIMS, Mangalore. She receives a prize money of ₹1,000 for the art and medicine competition. Serna Sakshi. So Sakshi receives a prize money of ₹1,000 for the art and medicine competition. A huge round of applause to these three winners for bringing creativity and art to life and medicine. We move on to the next. I request Dr. Soumya to join us. Give her a huge round of applause for organizing this art and medicine event. She is in charge and convener for the cultural committee. She is also assistant professor in Department of Biochemistry. Thank you, Dr. Soumya.
Okay.
Next, we move on to the Clinico-Pathological Conference, that is the winners for the CPC event. The first prize goes to Medha Acharya from Demedcon Medical College. Medha Acharya. Medha Acharya receives a prize money of ₹5,000 for CPC. I request our dignitaries to hand over the certificate and the cash prize to her.
Madam. Yes, yes.
Medha Acharya from Sri Devaraja Medical College takes the first prize. The second prize goes to Aishna Khurana from East Point Medical College of Medical Sciences and Research, Bangalore. Ms. Aishna Khurana receives a prize money of ₹3,000 for CPC. She takes the second prize for
Yes, yes.
CPC. Ms. Aishna Khurana receives the second place for CPC. Congratulations, Aishna. Great job to both for their analytical and diagnosis prowess. I request Dr. Suresh to come onto the stage. Dr. Suresh, sir. On behalf of the committee, I thank Dr. Suresh T, Professor and Head Department of Pathology for organizing CPC. And Dr. Sneha too. Next treasure hunt winners. So on behalf of Department of Pathology, one of you can just please come and then take over the token of appreciation on behalf of Sir Shilpa, Dr. Shilpa, can take the memento on behalf of Dr. Suresh sir, who conducted the event CPC for the students. I thank Dr. Suresh sir and Dr. Shilpa sir from the Department of Pathology. Next, we move on to the treasure hunt winners. For the adrenaline-filled treasure hunt competition, the winners are Prasanna B. Kolkar, Ayush Sangar, Prakar Gupta, Piyush Pandey from Sri Siddhartha Institute of Medical Sciences. They receive a prize money of ₹10,000. Ranjan for successfully solving the clues and finding the treasure. You receive a treasure of ₹10,000 for your reference. Congratulations, team. They are from Sri Siddhartha Institute of Medical Science, Prasanna B. Kolkar, Ayush Sangar, Prakar Gupta, Piyush Pandey. A huge round of applause to these.
Yes, sir. 1 second.
Next, we move on to the block and tackle winners. The winners for the block and tackle competition are Abhinav R. Ainapur from B.R. Ambedkar Medical College. He takes the first prize for the block and tackle event. He receives a prize money of rupees 3,000 for block and tackle. Congratulations, Abhinav R. Ainapur from B.R. Ambedkar Medical College. Second prize goes to Abhishek Kohli from Sri Devaraja's Medical College. He receives a prize money of rupees 2,000 for the block and tackle competition. Abhishek Kohli from Sri Devaraja's Medical College takes the second prize for block and tackle competition. Congratulations, Abhishek sir. Third prize goes to Mahani from Sri Balaji Medical College. She receives a prize money of rupees 1,000 for the block and tackle event. Plus Mahani from Sri Balaji Medical College. Congratulations, Mahani. She represents Sri Balaji Medical College. Kudos to all three of you for handling the twists and turns with grace. Congratulations. We now move on to the debate event. So in the fierce debate competition, the winners are, first prize goes to Disha Kakkar from Sri Devaraja's Medical College. She receives a prize money of rupees 3,000. Disha Kakkar from Sri Devaraja's Medical College.
Yes, madam.
The second prize goes to Brijmohan Rao from Sri Devaraja's Medical College. He receives a prize money of rupees 2,000 for the debate competition.
Yes.
The third prize goes to Raisin Gupta from Sri Devaraja's Medical College. Congratulations, Raisin Gupta from Sri Devaraja's Medical College. I congratulate all three winners of the debate competition. Your eloquence and argumentation were truly outstanding. Congratulations all of you. Next, we move on to the spell bee competition. The winners for this event, the first prize goes to Harshita from Sri Devaraja's Medical College. Harshita from Sri Devaraja's Medical College takes the first prize for spell bee competition.
Yes.
The second prize goes to Aishna Kurana from East Point College of Medical Sciences and Research, Bangalore. Aishna Kurana from East Point Medical College. Congratulations, Ms. Aishna Kurana. She receives a prize money of rupees 2,000 for the spell bee competition.
Yes.
The third prize goes to Dhanush from Siddhartha Medical College, Vijayawada. He receives a prize money of rupees 1,000 for the spell bee competition. Dhanush from Sri Siddhartha Medical College, Vijayawada.
Yes.
I congratulate all three winners. Fantastic job for showing such precision and mastery over words. I now call upon Dr. Sapna to come out to the stage. I request Dr. Please to hand over the certificate of appreciation and memento to Dr. Sapna for conducting the spell bee competition. We acknowledge her efforts from the organizing team. I now request Dr. Kalyani ma'am to join us on the stage. I request Dr. Please to acknowledge ma'am for being the advisory committee member of Demedcon 2024. I request ma'am to come on to the dais. We thank ma'am for being the guiding support for Demedcon 2024. She is the advisory committee member for the Demedcon 2024. We acknowledge ma'am. From the organizing team, I request our principal, sir, Divilan Prasad sir, Mulinaran sir, and Dr. Vishwas Ananta ma'am to acknowledge her efforts. Thank you, ma'am. Ma'am is also the director for R&D, SDUAHER, and she has R&D. She has a research committee. A huge round of applause to Dr. Prasad. It's not only this event, ma'am is responsible for so many areas from research. Thank you, ma'am. I now request Dr. Suresh to join us on the dais. He's from Department of Dermatology, Assistant Professor. He is responsible for the Sovereign Committee. He represents and is in charge of the Sovereign with Dr. Pranav, Department of Pharmacology. We acknowledge Dr. Suresh and Dr. Pranav for being the main reason for this stage. And whatever you are seeing on the front of the college gate, the reason behind our sovereign and the stage is all because of the efforts of Dr. Suresh and Dr. Pranav. We acknowledge their efforts from the organizing team. A huge round of applause to these two. I now call upon Dr. Sunil, our treasurer for Demedcon 2024. He's been managing the finance-related issues and related activities of Demedcon 2024. Thank you, Dr. Sunil. His associate professor from Department of Community Medicine. A huge round of applause to Dr. Sunil. Dr. Sunil, sir. I now call upon Dr. Ajay sir onto the dais. Sir is HOD, Department of Forensic Medicine. Sir is the warden for the hostel, boys hostel, and he's in charge for the accommodation related things of Demedcon 2024. We really are truly grateful to Dr. Ajay sir for managing all accommodation related things of Demedcon 2024. We thank you so wholeheartedly from the team of Demedcon.
Yes, sir.
Thank you, Dr. Ajay. Thank you, sir. I now call upon Mr. Srinivas, photographer, onto the dais, please. Mr. Srinivas. If Mr. Srinivas sir is not there, anybody who can take the moment on sir's behalf, please. I call upon Bharat, Mr. Bharat, photographer. All the video coverage, YouTube coverage, whatever is going on live now is all because of Mr. Srinivas sir and Bharat. The credit goes to them. A huge round of applause to Mr. Srinivas sir and Mr. Bharat for doing this event for us. The photography is covered by them. The YouTube video coverage is all because of those things. Thank you, the team of photography. We now move on to the feedback now for Demedcon 2020. I thank our dignitaries for the prize distribution. I request them to take their seats on the dais. May I now request one of the students from SDMC and two students from the other medical colleges to come and give their valuable feedback. May I request Mr. Brij Mohan to give us feedback on Demedcon 2020.
A very good evening, everyone. Well versed, well conveyed, the idea of learning and pursuing medicine. That was the whole idea of Demedcon. I'm overwhelmed to witness the magic of words, phrases, and ideas being transpired in the atmosphere of our own college SDUMC. These 3 days have opened a new horizon of medicine and MBBS for us. The events were rejuvenating, energetic, and fulfilling. Each word, line, and phrase of a notable speaker have made a lifetime impact on all of us. I would like to mention a few of them. Be selective of what you see and what you absorb. Be critical, be flexible, and be a thinker. Finally, what matters the most is happiness. So these were the notable lines which were shared by some of our speakers, which really truly inspired us. The organization's precision was amazing. We delicate kids, food arrangement, the neon banks which were given during the social nights on the first day, and above all that, the hospitality. Like the kind of hospitality we have shown as SDUMC, that's amazing. There are two true words to define Demedcon 2024, as Dr. Vinutha Shankar ma'am said, that is satisfaction and gratification. So yes, we were truly satisfied and gratified by the conduction by our college, and my heartiest thank to all the dignitaries for guiding us through the path, for giving the vision of Demedcon, all the organizing committee who organized the event, and lastly the students and my juniors who conducted this event, and cheers to SDUMC, the entire family. Thank you.
Request the other delegates to give their feedback. So before taking the feedback, I call upon Dr. Mohan onto the stage. He is responsible for the transport section. The transport has been successful only because of him, the people, the delegates are reaching home safely, including me. Thank you, Dr. Mohan, for making our travel safe. I request our dignitaries to hand over memento to Dr. Mohan. He has done a wonderful job. Made the accommodation or transportation. I really acknowledge the team of accommodation, food, and then transport section for making this event successful. Without these people, the event would not have been possible, and I couldn't have slept peacefully. Thank you so much, all three of you. I request Dr. Vishal also to join us on the stage. He is also responsible for the transport. Forensic medicine. I acknowledge his efforts. May I now request one of the external delegates to give the feedback.
Hello guys, my name is Sagar. I am from SABB MCR, Sri Atal Bihari Vajpayee Medical College from Bangalore. It's really glad to be a part of this event. Actually, when we entered, me and three of my friends, when we entered the college, as soon as we entered, we were greeted, and it was so well organized that we didn't even find it any difficult to move around and find our places or drop off our baggages and luggages at our stay. And afterwards, we were en route to our breakfast place. I really have to emphasize on the food because it was really amazing, and I am a good foodie as well. So, yeah. And all the 3 days, the breakfast and the lunch and even the dinner was well served, and I really appreciate and I want to give you gratitude. And the stay as well, I would say it was really well organized. It was given they gave us a room for just 2 of us, which was very surprising because no other college would really do that. All the events were so well organized and it was so smooth. So first day we had our quiz prelims, which we fortunately qualified and went to the finals. So we got to stay another 2 days, which was lucky for us as well. As a B route, luckily we went to art and medicine, where we spent 2 hours of our, I don't know if I would really do this if I was back at home or anywhere else, but then I spent 2 hours of my life literally drawing out or coloring. It felt like back in my school, where I used to have these SCPW classes, where I used to draw and express my feelings. So I would really like to thank all the organizers as well as all the people who have put in so much effort to run it so smoothly, and I had a wonderful experience totally overall. Thanks a lot. Thank you very much.
Thank you so much, Sagar, for wonderful feedback and for appreciating the food and surely convey your message to the food caterers. Thank you so much. I now request Dr. Vishwas to take over.
quick thanks to the student members, and before that, Dr. Ashwini NS, she was the organizing co-chairperson. Thank you so much for being here. Without your support, the Demedcon 2024 will not happen possible. Thank you. Next, I would like to call Nachiket, Organizing Secretary, also the PR of the batch. They have worked day and night to make this possible. Thank you, Nachiket. Next, I would like to call Likita. Likita is also the treasurer of the batch. Thank you, Likita.
Huge round of applause. More than that. They did more than that. They worked day and night for the Demedcon.
Deepak Raj. The one person who I would call many times a day. I would call him many times a day and totally him and would never mind doing whatever what I do. Thank you, Deepak. Samprita. Thank you, Samprita. Whatever the designs you see, the brochure, along with Dr. Suresh and Pranav, is putting the effort. Thank you so much, Samprita. Joint Organizing Secretaries, Faisal Rahman. Thank you, Faiz. Pooja. Pooja, Joint Organizing Secretary. All of them have multiple responsibilities, not just one, and they have all done it really well. And I thank them all. Okay? Thank you.
Thank our organizing chairperson, Dr. Vishwas. He is a wonderful team leader and I'm really privileged to be working with him. And Demedcon 2024, one of the main reasons the principals are welcome and our dignitaries is Dr. Vishwas. So give a round of applause to Dr. Vishwas. He deserves it. He deserves to be here. Thank you so much, Dr. Vishwas, for supporting me in conducting Demedcon 2024. I thank our dignitaries for. I now request our dignitaries to hand over the certificate to Dr. Jagdamba. I now request Mr. Samprita to deliver the vote of thanks.
Good evening, everyone. As we draw to a close, it is my great honor and privilege to propose the vote of thanks for today's valedictory ceremony. Hosted here at Sri Devraj URS Medical College, constituent unit of Sri Devraj URS Higher Academy for Education and Research. First and foremost, I would like to express my deep gratitude to the late Sri R. N. Jalapa, whose invaluable contribution guided us today. I would also like to express my gratitude to Sri G.H. Nagaraja, President SDUET and Chancellor SDUHER, Sri Rajendra J, Vice President SDUET, Sri Hanumant Raju, Secretary of SDUET, Sri Dr. D.V.L.N. Prasad, Chief Administrative Officer SDUHER, Dr. B. Venkama, Vice Chancellor SDUHER, Dr. Muninarayanan, Registrar SDUHER, Dr. Prabhakar K, Dean SDUHER and Principal of SDUMC, and Dr. Vinita Shankar MS, Vice Principal of SDUMC, for guiding us through this journey. A special thanks to our guest speakers, Dr. Ramakrishna Prasad, Dr. Sharan Srinivasan, Dr. Geeta Jadwani, Dr. Radhakrishnan, Dr. Rakesh S. Nair, Dr. Janani Muralidharan, Dr. Savya Prera, Dr. Somu Shivapalan for sharing their expertise and offering valuable perspectives during their plenary sessions.
We're also incredibly grateful to our workshop resource person, faculty in charges and student in charges. Their hands-on sessions were truly enriching, providing us with practical knowledge and skills that we can take forward in our respective fields. None of this would have been possible without the tireless efforts of our organizing committee. I would like to thank our organizing chairperson, Dr. Vishwas, and our organizing co-chairperson, Dr. Ashwini, and our entire team for their meticulous planning and seamless execution of this conference. Your dedication and hard work behind the scenes have been instrumental in making today a success. Our sincere appreciation goes out to all our sponsors. Last but certainly not, I would like to thank all the participants, delegates, volunteers, and team Artemis who have contributed to the success of this event. Your active engagement, enthusiastic interest throughout the workshops, plenary sessions, and events have made this Demedcon 2024 a memorable one. In conclusion, thank you all for being here today and making this event a grand success. We hope you found this discussion enriching and workshops insightful. We look forward to meeting you again in the future conferences and events. Thank you very much.
Thank you, Ms. Samprita. I thank the organizing batch, that is Artemis. A huge round of applause to Artemis. Artemis and you all. Thank you, organizing batch. I owe my thanks and gratitude to our dignitaries, our delegates. I thank each and every one of you who played a part in Demedcon 2024, no matter how big or small. You have made this event a grand success, and we look forward to welcoming you again next. Once again, thank you all and safe travels back home. We hope to see you at Demedcon 2025. You all rock. Thank you so much. Thank you, dignitaries. We will now conclude the event with National Anthem. May I request all of you to raise
Jana Mana Adhinayaka Jaya He Bharat Bhagya Vidata Punjab Sindhu Gujarat Maratha Dravida Utkala Vanga Vindhya Himachala Yamuna Ganga Uchchala Jaladhi Taranga Tava Shubha Name Jage Tava Shubha Ashish Mange Gahe Tava Jaya Gata Jana Gana Mangala Dayak Jaya He Bharata Bhagya Vidata Jaya He Jaya He Jaya He Jaya 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 He.
Request all of you to join us for the group photo. All the delegates here, the faculty members, please join us on stage for the group photo with our distinguished dignitaries. We won't get a chance again, please.